Last Tuesday, one of my patients, 62 years old, diabetic, arrived at the emergency room in the middle of the night, doubled over in back pain. Kidney stone. It happens every day in every hospital in America. The ER doctor ordered an absolutely routine test, but nobody asked a single question. Nobody asked what medication she was taking at home. 12 hours later, she was in the ICU. Her blood was turning acidic. Her organs were beginning to fail one by one. And the culprit was not the kidney stone. It was the medication she had been taking for years. The same medication that millions of Americans are taking right now as you watch this video. Metformin. Glucophage. If you take metformin, if someone in your family takes it, or if you are pre-diabetic, diabetic, and might take it, watch this video to the end. Because what I am going to tell you today, no doctor has time to explain in a 10 or 15-minute appointment. And that test is so routine that you have probably had it done in the last 2 years. And that is exactly why it is so dangerous. And the scariest part, in the emergency room, almost nobody asks the right question. Patients rarely know they need to say something. And sometimes, as happened to my patient, by the time someone figures it out, it is already too late. Today you will find out what that test is, why it can kill, and the golden rule, one single sentence, 10 seconds, that can save your life or the life of someone you love. Do 3 things for me right now. Like this video, subscribe to the channel, turn on the notification bell, and most importantly, share it right now in your family group. Someone you love takes metformin, I know it. And they need to know this before they walk into an emergency room. And tell me down below, do you or someone close to you take metformin? How long? Where in the country are you watching from? Write it below. Let's go. First, I need to reassure you because metformin glucophage is a brilliant medication. It is the #1 treatment for type 2 diabetes worldwide. It almost never causes hypoglycemia, meaning low blood sugar. It helps with weight control. It protects blood vessels. If your doctor prescribed it, they made the right call. In the United States, metformin is prescribed to over 90 million people. It is one of the most safely documented medications in modern medicine. Decades of clinical data support its effectiveness and safety. It lowers blood sugar without causing the dangerous drops that other diabetes medications can trigger. It protects the heart, kidneys, blood vessels. It costs very little, and it is available at any pharmacy. But here's what very few people know. There is an international study called TAME from Targeting Aging with Metformin that is testing this medication as the first drug in the history of medicine capable of slowing biological aging. This is not science fiction, it is serious ongoing science conducted by researchers at the Albert Einstein College of Medicine in New York. Researchers observed that people who take metformin for diabetes tend to live longer, not only compared to other diabetics, but in some analyses, even compared to non-diabetic people of the same age. The same metformin you can buy at any pharmacy for a few dollars. And since we are opening up the behind the scenes, let me give you 2 clinical tricks, the kind no doctor has time to explain in a short appointment. Trick number 1. If you take extended-release metformin, the XR version, and one day you see the whole tablet in the toilet bowl, do not panic. Above all, do not stop taking it without consulting your doctor. Metformin XR is like a hard sponge. Your intestine absorbs the active ingredient from inside the tablet, and what comes out is just the empty shell. The medication will be in your blood, working perfectly. This happens because the tablet is made with a special polymer matrix that dissolves slowly but retains its outer shape. Many patients stop taking it unnecessarily because they think the medication is not being absorbed. That is not the case. Trick number 2. And this one saves people who cannot tolerate the first few weeks. Many people quit metformin right away because of the gas, bloating, and diarrhea. These side effects are very common in the first 2 to 4 weeks and depend on the dose and how it is taken. The trick is the sandwich. Let me explain. Do not take it before meals, not after. Take it in the middle. Eat half of your plate, swallow the tablet, finish eating on top of it. This is because food slows the absorption of metformin in the upper gastrointestinal tract, drastically reducing irritation of the mucous membrane. It completely changes the tolerability. Your stomach will thank you. If the discomfort persists after 4 weeks, talk to your doctor about switching to the XR version, which is generally better tolerated. Metformin is safe. Metformin is effective. Metformin may even extend your life. But here is the question you need to be asking yourself right now. The same question I asked myself when I saw my patient in the ICU. If this medication is so brilliant, how could a routine standard test done thousands of times every day in America have nearly killed a 62-year-old woman in 12 hours? Let's go back to my patient. 62 years old, diabetic, came to the ER at night with that unbearable lower back pain. The ER doctor, very competent, examined her, palpated, suspected a kidney stone, and ordered exactly the test he would order for any patient in that situation. A CT scan with contrast. That is the test. That large donut-shaped machine you lie down in, lasting only a few minutes. A liquid is injected into a vein to illuminate the internal images. It is performed thousands of times every day in America. It is one of the most common tests in modern medicine. It is used to diagnose kidney stones, pulmonary embolism, stroke, trauma, tumors. You have probably had one yourself or someone in your family has. But when metformin is circulating in your bloodstream, it stops being safe. Let me explain what happens inside. And I want you to understand this because it is straightforward and it is information that can save your life. That contrast fluid, the iodinated contrast dye, requires a brutal effort from your kidneys to be filtered and eliminated. Think of your kidneys as the filter in a swimming pool. The contrast dumps a heavy load all at once. The filter gets overloaded, slows down its pace. For a few hours, the kidneys work more slowly than normal. This phenomenon is called contrast-induced nephropathy and has been known to medicine for decades. In most people, it is temporary and harmless. But in people who take metformin, this renal slowdown triggers a chain reaction that can be lethal. Now, metformin also depends on these same kidneys to be eliminated. If the kidneys are busy processing the contrast dye, metformin gets trapped in your bloodstream, cannot be eliminated. Every dose you took in the last 24-48 hours keeps accumulating there. And when metformin accumulates beyond a certain level, it does something I need you to understand. It diverts the metabolism of your cells. Instead of producing energy the normal way, through the aerobic pathway with oxygen, your cells enter an emergency pathway. This emergency pathway produces lactic acid, a great deal of lactic acid, to the point where your body can no longer process it. Your blood, which normally has a pH of 7.4, almost neutral, begins to acidify. It drops to 7.2, then to 7.0. And when blood pH crashes, enzymes stop functioning, cell membranes get damaged, organs fail one by one. Heart, kidneys, liver, brain. This has a name. Doctors call it MALA, metformin-associated lactic acidosis. It is an ICU emergency, and the mortality rate when it is not identified in time can reach 50%. That is what the medical literature shows, published in journals like Critical Care and the Lancet. Half of the people who go into severe MALA do not leave the hospital. And do you know what is the cruelest part? The early symptoms are deceptive. Nausea, abdominal pain, rapid breathing, slight mental confusion. The patient is half awake, half drowsy. It looks like gastroenteritis, looks like anxiety, looks like anything. The rapid breathing is actually the body's desperate attempt to expel carbon dioxide to compensate for the acidosis. But without knowing that the patient takes metformin, without knowing they just had a CT scan with contrast, this combination of symptoms does not immediately lead to the right diagnosis. And the ER doctor, in the middle of the chaos of an emergency room, with dozens of patients in the waiting room, often takes time to connect the dots. By the time they connect them, sometimes it is already too late. That is exactly what happened to my patient. Nobody asked a single question. Do you take metformin? If anyone had asked that 3-second question, she would not have ended up in the ICU. I want to pause for a moment. Do you or someone in your family regularly have imaging tests with contrast dye? Have you ever told the doctor you take metformin before having a scan? Write it in the comments. Your experience can help someone else. Now you understand why I said at the beginning that a common medical test can be fatal for patients on metformin. But do not worry, because now I am going to give you exactly what my patient did not have. A golden rule you can use tomorrow if you need it. 1 sentence, 10 seconds that separates a calm CT scan from an ICU bed. Write it down or memorize it because it is the most important sentence in this entire video. I need to have a test with contrast dye. I take metformin. Just that. 10 seconds. That sentence activates a protocol. That sentence completely changes the course of treatment. That sentence can save your life. But Dr. Carter, what if it is an emergency? If I had a car accident? If there is a suspicion of a blood clot, a chest pain that will not stop? Do I have to wait? Excellent question. In those life or death situations, the hospital performs the test immediately, without hesitation, regardless of whether you take 500 milligrams of metformin or the maximum dose, because the risk of dying without a diagnosis is greater than the risk of lactic acidosis. No doctor will leave you without a diagnosis out of fear of metformin. But here's the difference between an attentive team and an inattentive one. In these cases, the hospital activates a 4-step protection protocol. And I want you to know what those steps are. Because if you or a family member arrive at an ER in a critical situation and you hear these 4 steps being carried out, you know you are in good hands. Step 1, the test gets done. If it is a matter of life or death, the CT scan is performed. Period. Saving the life is the absolute priority. No protocol about metformin overrides the need for a life-saving diagnosis. Step 2, immediate stop. Metformin is suspended the moment the patient enters the hospital. Not the dose for that evening, not the one for the next day. 0. The doctor orders the suspension the moment they learn about the medication. Step 3, the shield against the poison. Since metformin is already circulating in the blood, the team starts IV fluids if possible before, during, and especially after the test. That forced hydration does one fundamental thing. It forces the kidneys to work at an accelerated pace. The more fluids go in, the more the kidneys filter, the faster they eliminate both the contrast dye and the metformin. If the kidneys do not block up, metformin comes out. If metformin comes out, it does not accumulate. If it does not accumulate, it does not produce excess lactic acid. The crisis is avoided. Step 4, the 48-hour quarantine. Metformin stays suspended for 48 hours after the test. Not 1, not 3, 48 hours. New blood tests are performed to check on the kidneys, primarily creatinine and glomerular filtration rate. If the kidneys have held up under the contrast load and values have returned to normal, metformin resumes. If they have not held up, we wait a bit longer with close monitoring, and during this pause, if blood sugar control is needed, the patient is temporarily managed with insulin, no drama, no problems. So do not worry. Even in a very serious emergency, there is a protocol that protects you. This protocol works, and thousands of people go through it every month in the best hospitals in the world without any problem. But here is the central point of the entire video. This protocol only works if the medical team knows you take metformin, and in an emergency, nobody will guess. The medical record is often not up to date. The family member who came with you may not remember the exact name of your medication. The old prescription is in a drawer at home. Your primary care doctor is unreachable at midnight. The only person who can ensure this information reaches the right doctor at the right time is you. And that is why, at the end of this video, I am going to make a request that may seem simple, but is the most important thing you can do for your health after watching all of this. But first I need to tell you one last thing, because metformin is not the only medication that becomes a time bomb inside the hospital. Today, millions of Americans, probably someone in your family, perhaps you yourself, are taking 2 new classes of medications that are wonderful in everyday life, but inside the hospital, at the time of a surgery or an invasive procedure, can cause absolute disasters. And the worst part, they are so new that many doctors have not yet fully internalized the safety protocols. First-time bomb, the weight loss injections. Ozempic, Farxiga, Mounjaro. If you use any of these or know someone who does, pay very close attention. These injections belong to the class of GLP-1 receptor agonists. They do one very important thing. They slow gastric emptying. That is why you feel full for hours after eating little. That is why your appetite decreases. That is why you lose weight. The mechanism is brilliant for weight management. But this same effect inside the operating room can kill. You could perfectly follow the 8 hours of fasting prescribed, scrupulously as the anesthesiologist asked, but still have food in your stomach because the injection dramatically slowed gastric transit. And at the moment of general anesthesia, when the muscles relax completely, when the protective reflexes of the airways are temporarily suppressed, that food can come back up from the esophagus and go down the wrong way, into your lungs. That is what doctors call aspiration pneumonia, or Mendelssohn syndrome. It is serious, potentially fatal, and can require days or weeks in the ICU. The guidelines from the American Society of Anesthesiologists, updated in 2023, are clear and unambiguous. Weight loss injections must be stopped at least 1 week before any procedure under general anesthesia. Memorize this. 1 week, 7 days. Not 2 days, not 3. 7. And always inform the anesthesiologist that you take them, even if you have already stopped. Second-time bomb, Farxiga, Jardiance, and similar drugs. The SGLT2 inhibitors, dapagliflozin, empagliflozin, canagliflozin. Complicated names, elegant action. They work by blocking a protein in the kidney that normally reabsorbs glucose. The result? Glucose is eliminated in the urine instead of returning to the blood. Excellent for diabetes, extraordinary for protecting the heart and slowing kidney disease progression in everyday life. Important studies like EMPA-REG and DECLARE showed significant reductions in cardiovascular mortality. But in surgical stress situations, when the body enters war mode, when cortisol and adrenaline rise dramatically, when food intake drops due to fasting, these medications do something very dangerous. They continue to eliminate glucose in the urine. The body, perceiving a glucose shortage in the blood even when there is none, activates fat metabolism at an accelerated rate. Ketones are produced in excessive amounts. The blood acidifies, kidneys and heart suffer. And do you know what the most insidious part is? The blood sugar measured with the glucometer is normal. The anesthesiologist looks at the glucose meter, sees 110, 120 milligrams per deciliter, thinks everything is fine, suspects nothing. But the blood inside is turning acidic despite the normal blood sugar reading. This is called euglycemic ketoacidosis, literally ketoacidosis with normal blood sugar, a perfect trap, because the marker the team habitually uses to monitor glucose metabolism is normal and does not trigger any alarm. International guidelines are clear. Farxiga, Jardiance, and similar drugs must be stopped 3 to 4 days before any planned surgical procedure. Not the day before, not the morning of the procedure. 3 to 4 days. Do you see the pattern? Metformin, Ozempic, Farxiga? 3 completely different drug classes. 3 completely distinct mechanisms of action. 1 fundamental lesson. The medication that protects you at home can become a time bomb inside the hospital if the medical team does not know about it. And the only person who can ensure that we know remains you. I want to pause one more time. Are you taking one of these 3 medications? Do you have a planned procedure in the coming months? Have you already talked with your surgeon or anesthesiologist about when to stop the medication? Write to me in the comments. If you have doubts, my next video will be dedicated exactly to this topic. Now let me explain which vitamin metformin silently steals from you year after year without you noticing. If you have been taking metformin for 2, 3, 5 years and have started feeling constant tingling in your feet, a numbness in your legs that creeps in especially at night, a fatigue that does not go away even after a good night's sleep, legs that feel like lead and a fading memory, names that do not come right away, the right word that escapes you, do not blame the diabetes. And please do not blame your age. The continuous use of metformin has a known, proven side effect documented for decades in the scientific literature. Over the years, it progressively blocks the absorption of vitamin B12 in your intestine at the level of the terminal ileum. The mechanism is related to interference with calcium-dependent B12 transport. Without B12, your nerves progressively lose their protective covering, the myelin sheath. They are literally left exposed. Like electrical wires without insulation, the nerve signal disperses, slows down, distorts. That is why it tingles. That is why it goes numb. That is why your brain becomes slower. And the problem is that this deficiency develops slowly over years, and the symptoms come on so gradually that they get attributed to age or to diabetes itself. Meanwhile, the nerves keep getting more and more damaged. And if the deficiency goes uncorrected for too long, the neurological damage can become irreversible. A study published in the British Medical Journal showed that people who have taken metformin for more than 3 years have a significantly higher probability of having B12 levels below the normal range. The longer the duration of treatment, the higher the risk. The solution is simple. First of all, get your vitamin B12 measured in the blood. Do not wait for symptoms. Ask your doctor, "Doctor, I have been taking metformin for years. Can we check my vitamin B12?" A simple blood draw that can be included in a normal annual checkup. If it is low, a simple, inexpensive, and well-tolerated supplement resolves the problem and restores your energy and mental clarity within weeks or months. In some cases, the doctor will prefer intramuscular B12 injections because they ensure direct absorption without going through the intestine that metformin has made less efficient. Your doctor, internist, endocrinologist, family physician prescribes the right medication in the right formulation and dose for your specific situation. They know your history, adjust the doses, monitor your tests over time. Trust them. American medicine is among the most competent in the world. But when you walk through the door of an emergency room or get pushed on a stretcher into an operating room, reality changes radically. In the chaos of an emergency, information gets lost. Medical records are not always up to date or accessible. Doctors have never seen you before. Shocked family members forget the names of medications. Old treatment plans are in drawers nobody will open. And a forgotten detail, one single detail, can cost you your life. So in that critical moment inside the hospital, the main guardian of your health must be you. Not the doctor, not the triage nurse, not your son who rushed you in. You. And I am asking you for one thing. Just one thing that takes 3 minutes and can save your life or the life of someone you love. Take your phone right now. Right now, immediately. Pause the video if you need to. Open the Notes app, that yellow notepad, and write My Medications. Below that, make the complete list. Name of the medication, dose, how many times a day, why you take it if you know, one below the other. Include everything. Medications for the heart, diabetes, blood pressure, thyroid, for sleep, for joints, even the vitamin, the supplement, the eye drops, everything. Save the file. Give the file a recognizable name like My Medications in capital letters. Put the file on the main screen of your phone. You can also write this list on a laminated piece of paper and put it in your wallet, next to your driver's license or insurance card. Some patients tape it to a card in their bag or pocket. Wherever you want, as long as it is immediately findable. The next time you or someone in your family walks into an emergency room, a new doctor's office, or an operating room, show this list to the first professional who receives you, even before they ask you the routine questions. Do not wait for them to ask. Tell them yourself. Show the list. 3 minutes of effort today, a life saved tomorrow. And now the most important request of the video. Share this video in your family group, in your church group, with that diabetic friend, with that aunt who started using the weight loss injections, with that cousin who takes Farxiga, with that neighbor who has been taking Metformin for 20 years and knows nothing about this story. These people need to know. Maybe they will never find out if you do not tell them. And one share, one click can literally save a life. Remember the 3 fundamental things from this video. First, if you take Metformin and need to have a test with contrast dye, always and immediately tell the doctor or nurse, I take Metformin. That sentence activates a protocol that protects you. Second, if you take Ozempic, Farxiga, or Mounjaro and have a planned procedure, stop at least 1 week before and always inform the anesthesiologist. Third, if you take Farxiga, Jardiance, or similar drugs and have a planned procedure, stop 3 to 4 days before and inform the surgeon and anesthesiologist. And if you have been taking Metformin for more than 2 or 3 years, ask your doctor to check your vitamin B12. Do not wait for symptoms. Your doctor is your ally. But in the emergency room, in the emergency and the chaos, you are the guardian of your own health. Arm yourself with that sentence. Keep that list updated. Share this information with the people you love. My name is Dr. James Carter. I am a family medicine physician, and this is your health channel for people over 60. Remember to subscribe so you do not miss the next video. See you soon.